Well, Dr. Murat Aksoy joins us now in the studio. He's a professor of general and vascular surgery at Bahcesehir University and is currently working at Liv Hospital. Thank you for coming in, Doctor. So,
Thank you.
Just give us your sense. What's behind this huge increase?
Well, we know that especially there's an increase in terms of diabetes prevalence in mid-income and developing countries. The main reason for this problem is that I think we have changed the lifestyles that we are living. We changed the way we're eating, we changed the way we are working, we are being less active, we're not physically active. So especially the lack of exercise brings us to being overweight. And being overweight results in resistance to insulin. Now, when we eat something or when we drink something, actually our blood sugar rises. And in order to use the sugar as the source of energy, we need insulin. And our pancreas secretes insulin to bring the sugar into the cell to use it as the energy source. However, when we get overweight, especially the cells get resistant to insulin. So you cannot use sugar as an energy source, which brings up the level of your blood sugar.
Absolutely.
And in addition to that, actually being less active results in being overweight.
Absolutely. And you say that this is a change of lifestyle. Now, my question is,
Yes.
how do you stop that lifestyle continuing? Because people have more access to social media, the internet. People are becoming more and more sedentary, and that's just a trend that's going to continue, isn't it?
Yeah, unfortunately, if we keep on living like this, the trend will increase. It's coming massively, actually. Well, what to do, how to prevent diabetes, especially type 2 diabetes. Type 2 diabetes can be prevented by simple measures. First, we need to change the way we're eating. We need to eat more food in fiber. We have to stop eating processed food or limit it, at least limit it. We have to exercise daily. At least we can walk for 30 minutes 5 times a week, which is sufficient. In order to reduce the risk of diabetes and cardiovascular complications of diabetes, we have to exercise, we have to eat well. And of course, there are things in the world that you cannot change, such as genetics. If you have diabetes in your family running, then you'll be more prone to diabetes, so you have to be more careful.
Absolutely, and that's on a personal level, but let's look at this sort of more widely. It's very expensive for governments and for health organisations to treat people who suffer from diabetes, not only from the condition, but the complications that it leads to as well. Yeah. So where does that leave us in terms of the amount of money that could be spent on this in the coming years?
Well, the budget load of diabetes treatment is really high, especially for those countries who are still developing or underdeveloped. So we have to use the media, the social media, very effectively and tell everyone that you have to take the simple measures not to have diabetes, because otherwise we have to face the complications of diabetes. You know, the complications of diabetes include a stroke, blindness, heart attacks, kidney failure, and amputation. It's the leading cause of amputation worldwide, diabetes. So for the governments, we have to tell everyone that simple measures are enough to limit this massive attack of diabetes.
And Doctor, just finally, where do you think medical technology has a role to play in this? Obviously, over the years, the way that we treat diabetes with insulin, the way that it's administered has changed. We're just doing a piece about it earlier, about a patch that can be used to deliver the drug. Do you think medical technology has a role to play in this, in kind of helping deal with diabetes and the epidemic that is?
Well, I'm sure that it's going to help in the near future. There are many advancements in the technology, and so we doctors are really enjoying this advance in technology. And I believe that the advancement in technology will help us in maintaining normal levels of blood glucose, which will prevent complications. You know, we have the new insulin pumps now, but they are usually useful in type 1 diabetic patients, and I'm sure that new advancements will ensue.
Absolutely. Well, Dr. Aksoy, really good to have you come in. Thank you. I have to leave it there, but thank you so much.
Thanks.